In this video, we're going to be talking about carotid disease. Carotid disease is when you develop an atherosclerotic plaque inside the carotid artery, decreasing the blood flow to the brain. And carotid artery disease is when you develop plaque and narrowing in the carotid artery, similar to what happens in the heart when people have a heart attack, or in the legs in patients with PAD. If you develop plaque in the carotid artery, you are at risk for developing a stroke. Indeed, carotid disease is responsible for about 15% of the strokes. The risk factors are the same, the risk factors for heart disease or PAD, which include smoking, diabetes, high cholesterol, and hypertension. But obviously, genetics also play a role on that. The problem with carotid disease is it's usually asymptomatic, which means most of the time you don't detect until it is too late when you have a stroke. Some patients, which I would consider lucky, they develop what's called TIA, or transient ischemic attacks. And they're called mini strokes, but they are little temporary strokes. You may have a sudden loss of vision, or you may have a sudden numbness or a sudden weakness that resolves usually in a few minutes. And they not only can be disturbing, but they can be a signal that a stroke may be about to happen. But like I said, most patients that have carotid disease are asymptomatic, so the only way to actually find out that you have it is doing a screening ultrasound, which is a simple, quick test that can be done in our office.